COVID has cast the spotlight on the plight of those living with comorbidities like diabetes. Unfortunately, treatment for such disorders has fallen through the cracks as we focus on the health crisis. Now, according to Stats SA, over 4 million South Africans are living with the disease. Is it the leading cause of death in South African women? Well, this week, South Africa held its inaugural Diabetes Summit, and to discuss how better to respond to the diabetes crisis, we're joined by Bridget McNulty, who's the chairperson of the Diabetes Alliance. Bridget, thank you very much for your time. Now, in terms of awareness around diabetes as the #1 killer, as has been said in several reports of women in South Africa, do you think there's enough awareness around this?
Thank you so much for having me. There is definitely not enough awareness around diabetes. So it's the leading cause of death in women and the second leading cause of death in men. We should all be talking about diabetes all the time. And unfortunately, what happens is that we talk about it in November because it's National Diabetes Month. And then the rest of the year, it kind of falls by the wayside. And we urgently need to change that because we're in the middle of a diabetes crisis.
And then the summit itself, it was the inaugural summit, the purpose and what came from it?
It was fantastic. It was so exciting. So as you said, it was South Africa's inaugural Diabetes Summit. And what we really wanted to do was, as the Diabetes Alliance, which is an alliance of all the organizations, associations, and companies working with diabetes in South Africa, we wanted to look at the diabetes situation currently and take stock of what has happened, where we are, what the problems are, and what some of the solutions are. And so we launched South Africa's first diabetes charter, which is a document available for download for everyone on diabetesalliance.org.za. And in it, we look at 5 themes surrounding diabetes, which are aligned to the World Health Organization's Global Diabetes Compact. And we outlined the challenges in those themes and a few evidence-led proposed solutions. So what's so exciting about this is that it's the first time in South Africa that everyone who is working together with diabetes has joined together. We've created this document, and it's almost a menu for where to go next. So what we can do now and how we can help.
No, we certainly will go and look at that document, but because we have you here, we might as well just utilize your expertise. When we speak of diabetes, what are the causes? Because I know growing up as a young girl, my grandmother, fairly educated, but nevertheless, she thought that sugar diabetes was caused by eating too much sugar.
That's such a common misconception. And I think the trouble is that there was a lot of media attention around the fact that type 2 diabetes, which is what we're largely talking about, that's 90% of diabetes. There was a lot of media around the fact that they called it a lifestyle disease. And that's not exactly fair because there is a strong hereditary component to type 2 diabetes. It runs in families. As we know, certain races are more prone to develop type 2 diabetes. But there is a strong lifestyle component as well. So what that means is if you're carrying extra weight, particularly around your middle, if you're eating the wrong kinds of foods, lots of fast foods and refined carbs and sugar and fizzy drinks, that's going to contribute. And if you're not moving enough, if you are living, as we say, a sedentary lifestyle. But there are certain risk factors that I'd love to just share with your viewers today, because if you're over 45, you should be getting an annual diabetes check at your local clinic or pharmacy. It's a very simple fingerstick blood test. You'll know results within 5 minutes, and that will let you know if you need to be concerned about developing diabetes later. And that's if you're over 45, if you're overweight or obese, if you're not doing a lot of exercise, if you have a family history of diabetes. High blood pressure and high cholesterol are also risk factors. A heart disease history, if you're in a high-risk ethnic group, as I said earlier, Asian, Indian, or colored, if you've had diabetes during pregnancy, and if you have PCOS, polycystic ovarian syndrome, that all means you definitely need to be getting an annual diabetes check.
And then the male stats. I know there's a lot of sensitivity around that. We have several men that are afflicted. They have diabetes, but there would be many misconceptions around how diabetes affects men's health in particular. And many of them are either fearful to go and check for diabetes. What are the stats around men and diabetes?
So as I said earlier, it's the second leading cause of death in men in South Africa. And the reason I keep repeating this is that it blows my mind because diabetes is not a lethal condition. Type 2 diabetes, if it's diagnosed early enough, is reversible. If it's diagnosed later, it's manageable with lifestyle changes, which is changing your diet, losing weight, and exercising more. And thereafter, you would need to go on to medication, which is usually pills and later insulin. But it's an entirely manageable condition. It should never be killing anyone, and yet it's such a lethal condition in South Africa. And the trouble with men, as you say, is that many people are afraid of a diabetes diagnosis because one of the symptoms of uncontrolled diabetes is impotence. Yes. But I do want to stress the fact that that's uncontrolled diabetes. So if you are diagnosed and you're on the right medication and you're eating the right kind of food and looking after yourself, you can live a perfectly normal, healthy, happy life. But because so many people in South Africa, 1 in 2 people in South Africa with type 2 diabetes are undiagnosed, that means that by the time they're finally going to the clinic or hospital, they're at the stage of long-term complications. And that's kidney failure, heart disease, amputation, blindness. The long-term risks are awful, but they are all manageable or preventable if diagnosed early enough.
Sure. Bridget, thank you very much for your time. I'll be going to get my test. Of course, nowhere near 45, but definitely worth testing. Thank you very much. That was Bridget McNulty from the Diabetes Alliance talking to us there.